Hello, and welcome to MedNerds. I am your guide today, and I'm excited to help you on your journey from being a pharmacy graduate in India to becoming a registered pharmacist in the United Kingdom. If you have completed your B.Pharmacy or M.Pharmacy degree and you dream of working in the UK healthcare system, this video is for you. We will cover everything step by step. From checking if you are eligible, to English language tests, university applications, visa process, the OSPAP course, training year, and finally, the registration exam. By the end of this video, you will have a complete roadmap to achieve your goal. So let us begin this journey together. Let us start with understanding what OSP means. OSPP stands for Overseas Pharmacists Assessment Programme. This is the official pathway for pharmacists trained outside the European Economic Area to register as pharmacists in the United Kingdom. The complete journey takes approximately 2 years. Here is how it works. First, you will complete a 9-month OSPAP course at a UK university. This course teaches you UK pharmacy laws, clinical practice, and pharmaceutical standards. Second, you will complete a 12-month foundation training year where you work in a real UK pharmacy under supervision. Third, you will pass the GPhC registration exam. Once you complete these 3 steps, you become a fully registered UK pharmacist. The starting salary for UK pharmacists ranges from £35,000 to £45,000 per year, with excellent opportunities for career growth. Thousands of Indian pharmacists have successfully completed this journey, and you can too. Now, let us check if you meet the eligibility requirements for the OSPP pathway. First requirement, you must have a recognized pharmacy degree. For Indian students, this means a B.Pharmacy or M.Pharmacy degree from a PCI-approved institution. Your degree must be at least 4 years in duration, or 3 years plus 1 year of practical training. Second requirement, you must be registered as a pharmacist in India. If you are not yet registered with your state pharmacy council, you need to complete this registration first. Third requirement, you must prove your English language proficiency through either IELTS or OET exam. We will discuss this in detail in the next section. Fourth requirement, you must pass the GPhC eligibility assessment before applying to any university. This assessment checks if your qualifications meet UK standards. Please visit the official GPhC website to confirm that your degree is on their recognized qualifications list, as this list is updated regularly. English language proficiency is a mandatory requirement, and many applications face delays because of this. The UK accepts 2 main tests. First option is IELTS, which requires an overall score of 7.0. with at least 6.5 in each section, including listening, reading, writing, and speaking. Second option is OET, which stands for Occupational English Test. This test is specifically designed for healthcare professionals. For OET, you need a grade B in all 4 sections. Which test should you choose? IELTS is more widely available in India and usually costs less. However, OET uses medical vocabulary and healthcare scenarios, which many pharmacy students find easier. My advice is this. If your general English is strong, choose IELTS. If you are more comfortable with medical terminology, choose OET. Important note, your test results are valid for only 2 years. So plan your test date carefully to match your university application timeline. The GPhC eligibility assessment is your first official step. GPhC stands for General Pharmaceutical Council, which is the regulatory body for pharmacists in the UK. This assessment is an online application where they evaluate whether your qualifications meet UK standards. You will need to submit several documents: your pharmacy degree certificate and transcripts, your registration certificate from the State Pharmacy Council in India, your English language test results, either IELTS or OET, and a detailed work experience letter if you have any professional experience. The assessment fee is £687, Processing takes approximately 6 to 8 weeks. Here is an important tip. Make sure all your documents are properly attested and translated into English if necessary. Any missing information or errors will cause delays. Once approved, you will receive an eligibility letter that is valid for 2 years. This letter is essential for applying to OSP courses. Do not lose it, and make sure it does not expire before you secure your university place. Now let us talk about choosing your university. Several UK universities offer the OSPP course, and each has unique strengths. Aston University in Birmingham is known for excellent placement support and career services. University of Brighton provides great support for international students. University of Hertfordshire has strong industry connections. Kingston University London offers excellent location advantages. University of Sunderland provides more affordable tuition options. University of Portsmouth has a strong reputation for pharmacy education. When choosing your university, consider these important factors. Tuition fees range from £14,000 to £18,000, depending on the university. Location affects your living costs significantly. London is much more expensive than cities in the north of England. Placement opportunities vary between universities. And student support services for international students are very important. My advice is this. Do not just look at university rankings. Contact current Indian students through LinkedIn or Facebook groups. Ask about their experiences, the placement support they received, and visa sponsorship rates. This insider information is extremely valuable for making your decision. Once you receive your university offer letter, it is time to apply for your student visa. You will need a Tier 4 student visa, which is now called the Student Route Visa. Here are the requirements you must meet. You need a valid passport. You need a confirmation of acceptance for studies letter, also called CAS, from your university. You must show proof of funds to cover your tuition fees, plus living expenses. For living expenses, you need to show approximately £1,334 per month if studying in London, or £1,023 per month if studying outside London, for up to 9 months. You need tuberculosis test results from an approved clinic. And you must pay the immigration health surcharge, which is currently £470 per year. The visa application fee is £363. Here is a money-saving tip. The immigration health surcharge gives you access to the National Health Service during your studies. Start your visa application at least 3 months before your course start date, because delays are common during peak seasons. Also remember, you cannot enter the UK more than 30 days before your course starts. The OSPAP course is intensive, but very manageable if you stay organized. It is a 9-month full-time program divided into 3 trimesters. The curriculum covers UK pharmacy law and ethics, clinical pharmacy and therapeutics, pharmacy practice skills, and pharmaceutical sciences. You will attend lectures, practical sessions, workshops, and regular assessments throughout the course. The course fee ranges from £14,000 to £18,000, depending on your chosen university. Now here is something critical that many students miss. You must apply for the ORIEL recruitment system before or during your OSPP course. ORIEL is the centralized system for foundation training placements in England and Wales. The application window usually opens in February or March for training placements starting the following summer. If you miss this deadline, you will have to wait another entire year. Many students focus so much on their coursework that they completely forget about ORIEL. Then they graduate with no training placement lined up. Do not be that student. Mark the ORIEL deadline in your calendar right now and set multiple reminders. After completing your OSP course, you will enter the 12-month foundation training year. This is where all your theoretical knowledge meets real-world practice. You will work in a UK pharmacy under the supervision of a designated supervisor. This can be in a community pharmacy or a hospital pharmacy setting. During this year, you will complete a competency-based training program and submit regular progress reports to demonstrate your development. The best part is that you get paid during this training year. Salaries range from £22,000 to £28,000 per year, depending on your location and employer. London and major cities typically pay more, but remember that living costs are also higher in these areas. The foundation training year is not just a formality. It is designed to ensure you can practice safely and effectively in the UK healthcare system. Your supervisor will assess your clinical skills, your communication abilities with patients and colleagues, and your professional conduct. At the end of the year, if you meet all the required competencies, you will become eligible to sit for the GPhC registration exam. The final step is the GPhC registration exam. This is a 2-day assessment that tests your pharmacy knowledge, clinical skills, and professional judgment. Day 1 is a computer-based multiple-choice exam covering pharmaceutical calculations, pharmaceutical sciences, and pharmacy practice. Day 2 involves practical scenarios and case-based discussions where you demonstrate your clinical reasoning. The exam is held twice each year, in June and September. The exam fee is currently £805. Preparation is absolutely essential. Many candidates fail on their first attempt because they underestimate how challenging this exam is. Start preparing at least 3 months in advance. Use official GPhC study resources, join study groups with other trainees, and practice pharmaceutical calculations every day. Once you pass this exam, you will receive your official registration certificate and your unique pharmacist PIN number. You can then officially call yourself a UK registered pharmacist. Starting salaries for newly registered pharmacists range from £35,000 to £45,000 per year, with excellent progression to £50,000 or more as you gain experience. Congratulations, you have done it. Welcome to your new career as a UK registered pharmacist.